So let's just look down. The first one's really scary. Problems that I can have, and this is put in the woman's terms, it increases my chance of dying more than 2 times that of a vaginal birth. It's actually 3 to 4 times, but I didn't want to make it sound much scarier than it is. Having a cesarean with this baby increases my risk of having to have more in the future. I may have internal injuries due to the cesarean surgery. I have a more than 10 times chance of having an infection in my uterus due to this surgery. I have 3 times more blood loss with cesarean surgery, at least. I'm more likely to have anesthesia complications than with a vaginal birth. I'm likely to have pain for 2 to 6 months after my surgery. I'm 7 times more likely to have serious blood clots and go to my lungs after surgery. I'm 3 times more likely to have scarring inside my abdomen and bowel problems, often many years after my cesarean surgery. I'm 3 times more likely to come back to the hospital for complications after cesarean. I'm less likely to successfully breastfeed my baby and have a satisfactory birth experience. I may be in danger of losing my health insurance if I have a cesarean. Have you heard that one? There are a couple of companies in Florida that once you have a cesarean, you have a pre-existing condition because they know you're going to probably have another one, and so they just drop your insurance. But do women know that? Okay, then I think a lot of women would look at all those things, and often do, and say, like teenagers, that's not going to happen to me. You know, I'll come through this, I won't have any trouble. But what really isn't explained is the effects on the baby. And I think that's what can really make people change their mind and think a lot more about it, because everybody wants their baby to be the smartest kid on the block, you know. So problems for my baby. It has twice the chance of dying in its first year after cesarean, even if I had no pregnancy complications or problems. And this is the one I mentioned before. If I have a cesarean before natural labor begins, my baby is more likely to be premature and its brain not completely developed. This can lead to intensive care, breathing troubles, breastfeeding troubles, brain development problems, and trouble learning in school, and greatly increased costs for my family for child's care. My next baby has twice the chance of being stillborn. My next baby has a much higher chance of the placenta being in the wrong place, and that relates to the one before about the stillbirth, somewhat, not always. And last, it's safest for my baby and me to wait until natural labor begins before a cesarean is decided upon. And that's even if somebody has a problem, unless, of course, the baby has a problem and has to come out. So I know that's a pretty scary list, but it's based on science. So what kind of feedback do you have with that? What do you think about it?
This is exciting to see on a piece of paper that moms might actually be getting. You know, a lot of us here are doulas, and our clients come us with questions, and we try and give them information, and the doctors discredit it all. Oh, it's no big deal, it doesn't happen. And so it sort of puts us at a loss when we sit there and we see the truth. You know, we see it in our clients. So I know this is really exciting to me.
Yeah, there's that article in the New York Times last year about women doctors in Texas complaining about what problems you doulas are.
We are troublesome. I would say that it's exciting to me because I think when we talk about scaring pregnant women, I think that comes from an attitude like they or we need to be protected. And instead, informing them of the truth, while it's scary, it's giving the level of respect that they deserve to know what's really going on, what the truth really is. And so I find it very empowering, and I think a lot of patients would as well. I wanted to ask about number 2. I think it's my understanding that not only once you have a cesarean, you're more likely to have a cesarean, but also repeat cesareans have an increase in problems and complications. Isn't that
Yeah, the studies show that there's not a huge difference, but it is safer to have VBAC than a repeat cesarean.
Yeah.
I mean, it's a significant difference, but it's not gigantic.
Yeah, I guess
And
I
the
was
more-
I'd like to see that piece
well,
typed in there
okay.
if it's possible. Not to, add
No.
to the list or anything.
No, that's exactly what I want you to do.
My feedback. It's
Um,
a great list.
Let's see, the other, and then see there'll be a separate one for VBAC that they'll also
Yeah.
see. And I mean, if you go to a lot of hospitals now, the cesarean one sort of says, oh, everybody's doing this, it's wonderful. The VBAC one says, you do this, you're going to die.
Yeah.
For sure.
Right.
So,
That's convenient.
well, I know. Yeah, well, I was trying to get into some of the reasons that we see all this change with, to be fair, with women and male doctors. And even the American College of OBGYN, which does not set standards. I mean, even though people think they do, they give guidelines. Just like Moses came down from the mount with 10 guidelines, and where was I going with that? ACOG.
Probably about malpractice.
Yeah, but they're very concerned, and this came out about a year and a half ago in their monthly bulletin to us, was that it sounds like us old guys, are getting worried about the younger generation, but my son's an internist in Cleveland who graduated from USF in '93, and he's worried too that internists, OBs, pediatricians, none of them want to work nights and weekends. And ACOG was worried too. They say the new generation of doctors coming out wants their lifestyle issues, and they don't want to be called out at night, and they don't want to work weekends. So that's why a lot of this engineering of birth is going on, so that people can have their weekends free and their nights free. And as our studies with the Department of Health show, the highest number of cesareans done in the state of Florida is what time on what day? Friday morning. Because they're all scheduled. You don't have to wait till the afternoon because you're getting the operating room early in the morning. And it's a huge peak. I mean, and if somehow you can hide out till the weekend, you might be able to have your baby normally in a Florida hospital. So we ought to tell the babies that, because the babies probably start labor. And that's another thing, is a lot of the studies show that we're still not quite sure how labor begins, but there's a lot of evidence that the maturing of the baby's brain and the oxytocin from the baby's brain helps trigger labor in the mother. And so if the brain's not fully developed, that's not going to occur. Well, take these home with you, and I'm going to leave my email with Ann, and so if you want to comment or you think more about it or the way we ought to, yes, sure.
I just have a question. I mean, I've practiced in New York and California and here, and
All the great places.
as the labor and delivery nurse.
Okay.
And for some reason, I feel as though the post dates. What is post dates at this point, or is it state? Is it state? I mean, how is it?
41 weeks or more, and even at that, with modern testing of the baby, you can wait. But if everybody over 41 weeks had a cesarean after labor, I wouldn't complain. But
Right.
this is insane,
I mean, I just find that the inductions are being done for post dates. Inductions are being done earlier and earlier.
Oh, yeah.
Well,
I mean, I had
that's just what we said. I mean,